Hello, Heather.
Hello, Rich. Better with the mute off. You'd think you'd know by now. So, will I just go on?
Introduce yourself.
Yeah, so my name's Heather Moorhead, and I wanted to give you a bit more of introduction than is probably necessary, but you'll see why. My background is I'm an environmental health officer. I led a sustainable development NGO in Northern Ireland. I then was chief exec of our local government association. And then about 10 years, I moved across to lead the NHS Confederation in Northern Ireland. And this collaboration and thinking about how we get to better outcomes has largely been, I would say, pretty much my life's work about when you really boil down to trying to get to better outcomes in whatever context. It really is about working differently. So again, anybody that's been in Northern Ireland will know this is a divided society. So although we have 1.9 people and I am an ACE networker, a super connector, and I know pretty much everybody, and you can get pretty much everybody in the one room, I could tell you 500 stories about where we've tried to collaborate and it hasn't worked, where everybody tries to collaborate from their own perspective. So community planning layered on integrated area planning, layered on economic planning, all of that. So you can see that where it doesn't work. But I think during COVID, we could see loads and loads of places where it did, where again, probably Ross will get into this, it's the design of the system. So my first day that I was in the office, our permanent secretary had me in for 2 hours. I was amazed. And he said, Heather, if you can do anything to get a more collegiate approach across our health organisations, that'd be amazing. I thought, flip me, no problem. I'll be able to do that, no problem. That's my gig. And I hardly could get it to work at all not because of the people, but the design of the organisation, how the money flows, how things get measured, and the relationships, the top-down relationships. So my key focus is on design. So the example that there's loads of examples that have been amazing, some that have been great. And again, working on a sustainable development agenda, I have lots of techniques that get to shared purpose and that get to the magic. When people come together in a different relationship and discover together, something else happens. Loads of examples of that. But the one that I wanted to talk about today is one in Newtonabbey. It's called Thrive. It's a population of about 7,000, highly deprived area. And what this young woman who works for Bernardo's has done is she's created a pooled budget that is held by the Department of Education, and she's worked on early years and she's just filled it up. And that's really, really easy to say, but in a very hierarchical environment where people don't give away resources easily, this is an amazing achievement. But what she's been able to do is completely mobilize the community around the things that matter, working with the local population, or primarily focused on early years, but then moving back into families. And then she's getting loads of outcomes, but she's getting justice outcomes, education outcomes, drug and alcohol outcomes. We have NEETs, not in employment, education and training, all of those sorts of things. So at first people didn't know whether to give their money, and now people are phoning up going, we're trying to report the outcomes in the area are really great. Can we say that? And she says yes, because that's all part of the pooled budget. So she's got somebody else to hold it. So she's proper governance and a really strong governance framework, but she's done a lot of work to get everybody involved, the deep trust of the community. And I suppose my issue there is, and the point that I want to bring to the group is that they have shared purpose, that everybody in the area is working to make the area better. And she has done that brilliantly through using lots of different techniques to mobilize everybody and the intelligence of all the volunteers and the children. And then the organisations are supporting those people around place, because place is where you don't feel, oh, today I'm experiencing fuel poverty. Now I'm experiencing food poverty. Now I'm experiencing bullying. Now I'm experiencing something else. You feel those things all together. And when Claire talks about multi-solvers, when they're working in community, they've been able to change that. And even in working that, they've changed the nature of the relationships with the different government departments and the different stories. So that's my little story, but it demonstrates some of that. But I think it's the techniques, and again, maybe Ross will say more, it's the design of the way you're working. because there's 100 war stories that I've got that we haven't got it right. We've just said, let's collaborate, and it just doesn't work.